नमस्ते, मैं हूँ अलीशा फर्नांडिस और आप देख रहे हैं दिल से फिट। आज हमारे साथ एक ऐसे गेस्ट जुड़ गए हैं जो इन्होंने बहुत सा काम किया है इस फील्ड में और आज का टॉपिक हमारा बहुत इंटरेस्टिंग है। ये एक ऐसा टॉपिक है जो कभी ना कभी किसी के घर में ये टॉपिक तो आया ही होगा, ये हेल्थ प्रॉब्लम आई ही होगी, या तो इसके बारे में इसके इलाके अपने मोहल्ले में ये डिस्कशन हुआ ही होता है इस टॉपिक पे। हमारा आज का टॉपिक है ओवरऑल हेल्थ एंड कैंसर अवेयरनेस, अर्ली डायग्नोसिस कैन सेव लाइफ। इस पर और जानकारी पाने के लिए हमारे साथ आज स्टूडियो में जुड़ गए हैं डॉक्टर शेखर सालकर। डॉक्टर, आपका स्वागत है राष्ट्र टीवी पे।
थैंक यू।
डॉक्टर, जैसे मैंने बोला है, ये एक ऐसा टॉपिक है जो आई थिंक बहुत बार हमारे डायरेक्ट कांटेक्ट में आया है या तो इनडायरेक्टली अपने फ्रेंड सर्कल में। अगर देखा जाए तो गोवा में कैंसर का अगर ये डिजीज़ देखा जाए, ये कितना लेवल पे या कितना टाइम तक लोगों के पास आया हुआ है?
कैंसर इज दैट वे नॉट वेरी कॉमन, though it is discussed very too many times, because the most important part of the cancer is the death due to cancer is very painful, and that's why that bad name of cancer is that जो डर पैदा हुआ है वो is because of last 2-3 months of that cancer patient is really suffering. Number is less compared to any other diseases. The number is less. Cardiac also the number is much less of cancer. Like I would गोवा के बारे में बोलेंगे तो it will be 100 per lakh of population. हम लोग परसेंटेज में नहीं बोलते, हेल्थ के बारे में परसेंटेज नहीं बोलते। हम लोग 1 लाख पॉपुलेशन के लिए 100 पेशेंट में भी ऑफ कैंसर एक बरस में हो सकते हैं। That means it will go on piling.
Yes.
That's why the number becomes bigger. Like there are people who will survive for 1 year, 2 year, 5 year, 10 years. They will go on adding the pool.
जी.
But number is 100 per lakh of population.
जी.
So we are much better. Actually, it's not very bad. In the villages, very less in India. Overall India पकड़े तो around maybe 80 to 90 per lakh of population, including villages and all. It is very common in the cities.
Okay.
But important part is if you take states wise, we are at 100 per lakh. Kerala is around 130.
Okay.
Mizoram is 150. It's much better compared to USA,
Okay.
which is around 300 plus.
Oh.
So there are many more patients, but our population is high.
जी.
हमारा population इतना है कि that 130 will be equal to 500 population. So the total number of the patients there is huge pool.
Definitely.
Because our population is almost 1.4 billion. So that is the important part. And there is a variation between villages, then cities. There is sub gaps also. There is like tier 1 city, tier 2 cities.
Exactly.
All
जैसे
depends
कि
on
lifestyle
that.
भी
Because the
plays an
lifestyle
important-
and
Correct.
khana, bina, environment, everything changes from different places.
जी बिल्कुल.
So the least chance is in the very good villages where there is good environment, and there are other जो risk factors जो है कैंसर
जी,
में,
जी.
like they should
Like
marry
even
at the
the
right
food,
time. You
yeah.
should have right children, number of children, good breastfeeding होने की जरूरत है for the ladies with the breast cancer. But important part is in the cities, diagnosis may be little early because the facilities are much more
Correct.
compared to the villages.
Absolutely.
But if you ask me personally, I am very happy with the people who are in the villages.
Okay.
Because उनको कुछ भी एक हो गया, लंप हो गया, तो आएंगे और बोलेंगे ये देखो ये कुछ है, उसको देखो क्या करने का. They will not go on searching.
ऑनलाइन
वो डॉक्टर गूगल करके, अभी नए डॉक्टर आए हैं, वो डॉक्टर गूगल को तो इतना कंफ्यूज करके रखते हैं पेशेंट. पीपल आर नाउ कमिंग विद द शीट ओनली, एंड नाउ विद गूगल देयर इज जेमिनी एंड देन देयर इज चैट जीपीटी.
करेक्ट.
They will just say that I have got this and chat GPT will give you tuck 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 tuck.
These are the reasons, yeah. Correct.
Now we have to also as a doctor I have to see him what is his condition.
And there are
उनका
various
financials
parameters.
क्या है वो भी
Correct.
देखना पड़ेगा. Unnecessary I can't go on asking. They will tell you do PET scan, you do this, you do this, a lot of things.
Absolutely.
But finally patient को कैसे best treatment in minimum cost दे सकते हैं, that we normally see, and that's why every time the Google may not be correct.
जी बिल्कुल.
So people don't have to listen to the Google every time.
जी बिल्कुल. बट अगर हम बात करें यहाँ पे कैंसर डिटेक्शन एंड डायग्नोसिस इज़ वन थिंग विच इज़ emphasized nowadays because of the awareness that has been created over the years. So how important is early diagnosis?
No, early diagnosis is extremely important because in which stage you come to the doctor all depends on how long you are going to survive.
Okay.
Doctors may take the credit, but actually it is the credit of the patient that he comes early, because I cannot go on going to the house, every house, Baba, ye check karo, ye check karo. But if he comes in time, like I will give you example, like breast cancer if you come in stage 1, which is like 2 centimeter tumor in the breast, nowhere else disease is there, your chance is almost normal, 95% to 98% survival. If you come in stage 2, that means that 2 centimeters become 5 centimeters.
Correct.
And nowhere else disease. Still you are around 80%. So good. Drop by around 15%.
Correct.
Just by size increase. Then if the glands are positive in the axilla, and any number of size, that means you become in stage 3. In stage 3 it comes to around 60% or so.
Okay.
So, it drops. And in stage 4, that means it is there everywhere, maybe in the lungs, liver, bones, brain. Then it is only God has to be treating you.
Okay.
It is good. It's not that it is bad, but it's around 10% and all. So you have to be extremely lucky. You spend a lot of money. See, the important part of early diagnosis is not only that you will live longer, you will spend less money.
Correct.
Because maximum money is spent in stage 3 and 4. Because the new drugs which have come is all most of the time in stage 3 and 4.
Okay.
And that is a time when you spend huge amount of money and you just get little bit of life. Well, if you come in stage 1, you spend less amount of money and you get a huge life. Plus, in Goa में हमारे पास DDSY करके scheme है.
Correct.
Which is much better compared to the any other states which is giving, because patients can co-pay also and take a better room and other things, which is possible. And in that, all cancer operations, almost all operations can be done free of charge.
Okay.
Radiation is covered. Some part of chemotherapies are covered. So lot of support system is there from the government if you are coming early, and there is nothing available for stage 3 and 4. So it is, people should be happy to come early, get treated well, live longer, spend less money, and enjoy your life.
Absolutely. But अगर हम कैंसर की बात करें, are there any warning signs which lot of people sometimes tend to ignore कि it's okay, it's a regular thing that's happening. ये बहुत बार होता है हमारे डे टू डे लाइफ में. जब भी हम किसी के साथ इंटरेक्शन भी करते हैं, we just tend to oversee certain type of warning signs. Any specific warning signs with regard to cancer?
See, there is no specific signs.
Okay.
The signs are same as usual problems. I'll give you example now. Any lump in the breast. Any lump in the breast should be simple, ne?
Yes.
People should come forward. Still they don't come. Why? अगर वो कैंसर डिटेक्ट हो गया तो बाद में क्या? एक डर जो है, that they wait. नहीं, और पेन नहीं है, कुछ नहीं होता है. Why I should go to the doctor?
Correct.
But any lump anywhere, you must go to the doctor and take a opinion.
Okay.
90% of them will be simple ones, like fibroadenomas, fibroid and all like that, which are benign tumors. But to save those 10 people out of 900, these 90 people should come to the doctor just to see that those 10 people are also saved. Second thing is like, I will just give you an example. Like you have got normal habit of going to the motion early morning. You get up at 6 o'clock, 7 o'clock. Now you find that you have to get up at 5 o'clock. 2-3 दिन संडास नहीं होता है. होता है तो blood पड़ता है. Blood with mucus and all.
Yes.
That means you have changed your bowel habit. Bowel habit change हुआ तो कितनी बार होता है? Irritable bowel syndrome में भी होता है.
Okay.
That doesn't mean everybody will get cancer. But you need to go to the doctor and tell him and just get one colonoscopy done.
Okay.
See, खाली हाथ लगा के those days वो डॉक्टर हाथ लगा के मेरे को बोल सकता है कि उसको कैंसर है कि नहीं. वो those days are gone. You have to investigate. Like simple voice कम हो गया, आवाज नहीं आता है. टीचर्स का वेरी कॉमन रहता है आवाज. But if you take a rest, that voice should come to normal. But after taking rest, also that voice doesn't come to normal. That means there is maybe something.
True.
Then you have to do the DL-scopy or scope कर डाल के देखना पड़ेगा अंदर. Then very important symptom is don't feel like eating. Your chance of your appetite has gone down. you have lost weight, your motion has become, hard stools. These are all actually can happen in a very simple,
Absolutely.
even jaundice also.
Exactly.
वेरी सिंपल नहीं.
जी.
तो सब लोगों को बोलेगा अरे एक डॉक्टर ने मेरे को बोला कि थोड़ा सा ये हो गया तो डॉक्टर के पास आने का. इट्स वेरी कॉमन सिम्टम्स. आई एम ऑल्सो हैविंग कैंसर. नो. बट इफ इट इज नॉट इम्प्रूविंग इन मे बी अराउंड 3 weeks टाइम,
Okay.
you can give maximum 3 to 4 weeks. It should come to normal. If it doesn't come to normal, you have to investigate. Endoscopy, and now it is available. Ultrasound, endoscopy,
Ji.
chest X-ray is available.
Readily available.
Every village
Yes,
also
yes,
it is
yes.
available.
True.
So these are the important symptoms. Then in ladies, suppose your monthly period has stopped, and now it has restarted after 1 year. So at around suppose 49, your totally monthly period has stopped. एक 2-3 बरस में कुछ प्रॉब्लम नहीं. Now suddenly you find that again there is a bleeding has occurred. Most likely it will be dysfunctional uterine bleeding, which is a simple benign condition.
Okay.
But there is sometime it can be most likely cancer also.
Oh, okay.
So then you have to come to the doctor. So these things are, it looks very innocuous symptoms ekdam.
Absolutely.
But you must come to the doctor.
And
So
advice is better.
Advice, you have to take a doctor, and proper doctor you have to take advice and get yourself investigated.
जी,
See,
बिल्कुल.
those days, as I have told you again, I'm telling, stressing it. Those are gone when you just touch and see, except maybe breast cancer or oral cavity cancer, any ulcer in the mouth you find and not healing in 3 weeks time.
Okay.
Then you must come to the doctor immediately.
Okay.
So basically, the symptoms are same which other diseases,
जी.
but if it not healing or you are not feeling good, after around 3 to 4 weeks of treatment, simple treatment,
Okay.
you must come to the doctor and get investigated.
ओके सो डॉक्टर बट इसके कॉजेज क्या होते हैं लाइक वी हैव हर्ड अ लॉट अबाउट कैंसर कि कैंसर हो गया इवन टू अ पर्सन हु इज लाइक मे बी वेरी हैविंग अ हेल्दी लाइफस्टाइल आल्सो बट इसके कॉजेज एग्जैक्टली क्या है इफ यू कैन जस्ट ब्रीफली
The
टेल
most common cause is we don't know what is the cause. See, this is very common that like tuberculosis I will take it. Tuberculosis, we know that Mycobacterium tuberculosis causes tuberculosis. Typhoid, we know that typhoid सब बाकी का वायरस से virus से we know.
एवरीथिंग करेक्ट
In only one cancer we know why it is happening.
ओके
That is cervical cancer. That means the mouth of the uterus, which is caused by HPV virus, human papilloma virus, which is transmitted by sexual intercourse. So, because we know what it is the causing cancer, now there is a vaccine on that. So you can prevent your cancer.
करेक्ट
Rest, we don't know. We know risk factor. Like for example, tobacco.
हाँ
Everybody knows that tobacco can give rise to cancer. Still they smoke,
एब्सोल्युटली
but we can't help it. But tobacco is the single most preventable cause of cancer. That means you can prevent cancer. Almost 40, 50, 60% of the patients, those who are smoking, will get cancer over a period of time.
ओह
Tobacco. I mean like 30 cigarettes, 40 cigarettes, or those who are having. It's very common to have in cancer. But if you don't smoke tobacco, I will not get anything is also wrong. Because there are so many other causes. For example, very sharp tooth, simple one, sharp tooth in the mouth, and you are
Yeah.
not taking care of that. It is continuously rubbing your tongue on that. You will get tongue cancer.
ओह
You have a very spicy, food. Very spicy food. There are some people who
like
just love
they
that.
just love it correct
And continuously having that also is a risk factor. So these things are there, which is very important. And hot food also can give rise to, like chai, garam chai पीने का आदत होती है.
Lot of
There are
people.
some people you just give them hot tea
Absolutely.
and they just gulp it down. You can get burns inside, and you can get esophageal or oral cavity cancer. So these are very simple. And in a ladies, in a breast cancer, we know like less of breastfeeding.
Okay.
You don't do breastfeeding, your chance increases. Late marriages.
Okay.
Like after your first child, if it is born before the age of 30, you are decreasing your chance of getting breast cancer by 30%. Just by marrying a little early,
yes.
having first child before the age of 30, if you are getting 30% rebate on getting
Exactly,
cancer,
rebate it.
I would say rebate. But it's a simple one, right? It's
Correct.
not that you have to go somewhere and get investigated and all.
Absolutely.
Get married at around 20. I don't say that you should marry at around 16, 17, but you should get married around 27. And then have first child early, second child you can wait. And nowadays people don't want to have children. So no children also is a risk factor.
Yes, correct.
30% of our population, Goan population, 30% of the couples don't have children.
Yes.
Not that by choice, they don't have. Our fertility rate is 1.2. That means either you have one child or maybe two children. And previously we were thinking that in Goa, we were thinking that, okay, पहली लड़की हुई, तो we will try one more. पहले लड़का हुआ, तो और नहीं, बस. This was the thought process.
Mindset, yeah, correct.
Now it has changed. Even if you have first girl child, they don't go for second child. This is because there is both mothers and father are working condition.
Correct.
Parents are not on. It's a nuclear family. पहले हमारे साथ हमारे my mother,
Grandparents and
उसके बाद
everybody,
grandparents were there. So many other joint family. We enjoyed our joint family status. Now it is nuclear. You, your husband, and one child. Now, less children, that means less breastfeeding, less estrogen में जो progesterone जो healthy है वो आपके ऊपर act नहीं करता. Continuously bombardment of estrogen can give rise to breast cancer.
Okay.
And obesity now also is an important factor. Obesity in Goa, it is 45%.
Yes.
Ladies more.
Very alarming.
Alarming. This just yesterday's reports have been declared. So obesity is a factor. So these factors are controllable.
Okay.
I won't say that you will never, there are people who come to me and say, doctor, you told us I have more children, I have got 3 children, I have done good breastfeeding, so why I should get this cancer?
Correct.
Now see, everything we don't know. That's why I told you first that exact cause is not known.
Not known.
But what causes we know are these things.
And
And environment also.
absolutely, absolutely.
Environment also is the plastic and other things, your eating habits.
Correct.
All that crap food you have.
Absolutely.
What
The
else you
junk
will
food
get?
which
Yeah.
is there, that is there in the
हमारे
lifestyle.
टाइम में early morning we used to have bhaji, pav और चपाती घर में fresh बनाते थे.
Yeah.
Today what has happened? The diet has totally changed.
More to
Mother
frozen
doesn't have
stuff.
time to go to the
Yes.
market. Father doesn't have time to go to the market. They go on
Absolutely.
Sunday, bring chicken in pieces. Then you
Frozen
Monday, Tuesday,
thing,
Tuesday,
yes.
Wednesday तो फ्रिज में डाल के रखते हैं. Monday को वही खाते हैं. Tuesday को बनाते हैं तो 2-3 दिन वही खाना खाते हैं. So you must have fresh
food.
I have never eaten second day fish
Okay.
when I was a child. Means my uncle used to bring food, सब खाते थे, by evening finished. Next day never we have eaten anything next day. Now it is not possible because mother doesn't have time to do all these things.
Absolutely.
So the change of lifestyle.
Yes.
Lifestyle doesn't mean clothes. Lifestyle means all these things come in lifestyle
Correct.
only.
Correct.
You are marrying late because you are career oriented. You don't want to marry early because you want to pass graduation, then you want to do MBA and you want to do this and that. Then you want to earn money.
Doctor, but sometimes there's also the fact that a lot of people are not finding the right life partner. So that is one important fact, not only career oriented. So
Yeah,
that
that
happens,
is there.
yeah.
But you start early looking
Correct. Looking at it has to be early.
Yeah. Because previously parents used to see and they used to see Patrika,
Absolutely,
Bitrika
absolutely.
dekhte the and
And
used
then
to
they
have
should
married.
direct, yeah, correct.
And nowadays also, see, in cancer of the breast and all is least in Muslim population.
Okay.
Because they marry early, they have good children, best breastfeeding is in the Muslim community.
Okay.
Highest chance of getting breast cancer is in Parsi community.
Okay.
Because they are very small community. They marry within themselves. The genetic base which is there
Exactly.
is less.
That's what that was coming to my next question is how important is family history? And does it affect hereditary cancer? Can be passed on?
Yeah, family
hereditary?
history is there. It is there. But it's not a huge number.
Okay.
I would say it is around 5% to 7%.
So, but do I need to be worried? Like if in case suppose my grandmother
If
had
your
or something like
grandmother
that?
has been diagnosed when she was less than 40,
Oh, okay.
then yes. Nowadays we do BRCA test. So any patient who comes less than 40 with
Okay.
cancer,
Uh-huh.
we would love to do her genetic study.
Okay.
और सपोज फैमिली में 2 है, 2, one is 50, one is 60, 2 in the family, then also we would like to do genetic.
Okay. But
Problem of the genetic is like a time bomb for you. Suppose by
Okay.
chance
Can
that
you-
BRCA comes positive, then there is a stress on full family.
absolutely.
And if you have a
Any day.
daughter, then you will think, अरे इसका क्या करे अभी, she is going to get in future. इतना tension रहता है. So sometimes, I tell the patient, you come regular checking. And we will see whenever it happens, we will treat you.
But
rather than just hanging a sword on your this, that when I'm going to get
correct.
that. And BRCA positive, then you have to remove the full breast, both dono breast.
Okay.
Then you have to remove the ovaries. Then colon cancer also is a possibility, ovarian cancer. So,
The
it
other
is a bad
factors
luck
contribute.
what
Correct.
you can do.
Correct.
But to know that in advance, I don't know it. I give to the patient, you decide what you want to do. But if you are early breast cancer, then we do the test. It is important.
And also, doctor, if in case now, as you said this, is there any kind of possibility wherein we have to do an early checkup, or how often should we come and visit a doctor whenever we are thinking about, like, cancer may be back of the mind, but definitely for a health checkup in terms of detecting cancer, is there any specific test that we need to take?
If you have a strong family history, you must start at around 25.
Oh, that early.
Yeah. If you are a strong family, मैं 2-3 है हमारे family में.
Okay.
If you don't have any family, maybe around 35, 40 is
That's better.
okay. After 40, you must have a baseline, all the tests done. 40 is the cutoff mark.
Okay.
40, you must do all the baseline tests. Then you do either yearly, once in 2 years, whatever your doctor suggests. It depends on how the findings of the first, this is there.
Okay.
But you must do, rather than spending money on your birthdays, I think you spend on some
On a
test.
test.
So
Okay.
that you can get
Is there any
better.
specific name for this test?
No, it
What do
I
you
think
go
your
to a doctor
has
and
to
say?
be.
Doctor has to prescribe it.
Because it depends on which see, cancer can happen anywhere. You can't go on doing every test.
Okay.
But what is commonest in that area, you must do that. Like pap smear is cervical cancer.
Yes.
Breast cancer ke liye ultrasound in the younger patients or a
Correct.
mammography.
Correct.
And chest X-ray, which is a very simple one, we can do. And some blood tumor markers are there. If you are very high risk, then we do the tumor markers also.
Absolutely.
So that, we know this. Like simple stool examination. If there is no blood in the stool, you don't have to do any other test.
Okay.
If there is stool in the blood is
Blood
there
in
in the
the
stool, that means there is something is wrong.
True.
Likely that it may be piles also, but you need to do little investigation.
So it
and
can
simple
be detecting.
CBC test. If the counts are high, we know that some leukemia or some blood problems can be
Absolutely.
there. So
Absolutely.
simple test we can do.
Okay. So, doctor, now we are going to head towards our next segment, which is myths versus facts. So, I'll ask you a couple of statements which have come to us. You need to tell us whether it's a myth or a fact. Okay. So, सबसे पहला क्वेश्चन है, कैंसर का डायग्नोसिस होने के बाद ट्रीटमेंट का कोई फायदा नहीं होता.
This is the most horrible myth. I think the science has proved that if you do proper treatment, your life increases
Okay.
and you can get a quality life if you come early.
Okay.
Like in a head and neck cancer, if you come early, you can give a good,
Absolutely.
physic and in all those things.
Correct.
If you come late, you may lose the part of the jaw and other things. Lung, even breast cancer and all, you may lose the breast in case. If you come early, very small operation, you can do very well.
Okay. डॉक्टर द नेक्स्ट स्टेटमेंट इज मोबाइल फोन्स और माइक्रोवेव हमेशा कैंसर का कॉज बनता है.
Mobile is important how long you speak.
Okay.
Cancer, I would not say.
Okay.
But your other hearing loss and other things will. And you don't go on speaking for long period of time. Now you can use Bluetooth. There are so many things are available.
Correct.
And what other things you said?
Microwave.
Microwave doesn't give rise to anything. Problem is with the plastics.
Oh.
If
okay.
you use plastic in that microwave,
हाँ.
then is the problem. Otherwise, normal food and all, there's
Not
nothing.
an issue. Okay. The next statement is कैंसर ट्रीटमेंट के साइड इफेक्ट्स ट्रीटमेंट से ज़्यादा डेंजरस होते हैं.
I think it was there before, but now with better medicines available, like I would give you example, when I started my practice in 1990, the amount of vomiting patient is to get after chemotherapy and all was horrible. एकदम.
Okay.
Means it was looking like क्यों मैं उसको chemotherapy देता हूँ. There are some patients never is to come to me after they finish their chemotherapy. I don't want to see your face also.
They
Because
used
if
to
I
blame the
see your
doctor.
face, I remember all those things. मेरा बस से मेरे घर से जाते हैं तभी भी वो बोलते थे हमको we feel like vomiting.
Oh God.
इतने powerful थे. But now there are better medicines are available. I have hardly seen any patient who have suffered from any intractable vomiting and all. थोड़ा upsets, gastric upsets and are common.
That is it.
But see, if you have to have good survival, then some sort of problems will always be there.
Okay. This is a little bit I don't know how to say this, but yes, कैंसर का मतलब हमेशा मौत होता है.
These days are gone. Now cancer is like diabetes, hypertension.
Okay.
It's like a chronic disease.
Some relief.
What we are doing it now, we are making it like a chronic disease. Like there are some patient with lung cancer. When I started my practice, I have never seen anybody surviving for 6 months.
Oh, okay.
Anybody, not even 6 months. Now they are living for 4 years, 5 years, 6 years, 7 years with just tablet.
Absolutely.
So there is a tremendous advancement has occurred. And if you come in time, it's, as I told you, it is, if you come in time, it is normal. Ne?
Absolutely.
Now if you come late, there are ekdam sab everywhere it is spread, and now you feel that no, that
Something has to be done. I want to live. Yeah.
तो कैसा कर सकते? Yeah, still we can give better. Still, in
Okay.
stage 4 also, lung cancer and all, if you are EGFR positive or CL positive, on tablet के ऊपर they are living for about 5 years, 6 years.
Wow. Okay.
In stage 4.
Okay.
So, there is tremendous developments are there, even in lung, breast cancer and all, even with bone mats and every mats, people are living for about 5 years, 6 years easily.
Absolutely.
Only thing you should have vitamin E.
Absolutely. That is mandatory.
Because vitamin E, that's why I told you, maximum money is required when you are in stage 3 and 4.
True.
So that's why the vitamin, you have to do some insurance or something and save some money for your
That's what-
bed times.
Okay. So now we are going to move to our next segment, which is Q&A. In that, there's some questions which have come to us via viewers. Like, अगर कोई lump या सूजन महसूस हो तो कितने दिन वेट करना चाहिए डॉक्टर के पास जाने से पहले?
If you don't have pain, is important. This is also myth. Then मेरे को दर्द नहीं है तो मैं क्यों डॉक्टर के पास जाऊँ? But if you have pain, that means it is infection.
Okay.
So unlikely that it will be. You can take some antibiotic and say and wait for some time. Around 10 days you can see if it persists more than around 2 weeks, then you must come to the doctor, because by the time he investigates, it
जी.
takes time. So around 3 weeks, 4 weeks is a good time to
period.
wait. Yeah.
Okay. हमारा अगला क्वेश्चन जो आया है, विमेन को ब्रेस्ट कैंसर स्क्रीनिंग किस एज से शुरू करनी चाहिए?
No, that's what I told you. In case you have a history, our
Yes.
family history में है तो around 25 onwards.
Okay.
That no family history, that may be around 35.
Okay. Doctor, we have time constraint. Any particular message that you would like to give to our viewers watching you before we end the show?
You want to be healthy, then you have to follow 3 magic bullets. First, keep yourself fit. That means run around. Don't become obese. Second is have lots of vegetables. As far as possible, no red meat. Lot of fruits, vegetables, water intake. And last is stay away from tobacco and alcohol.
Absolutely,
Bas.
doctor.
And it is not only for cancer. Overall also it will help you.
Absolutely, doctor. Doctor, you came to our studio, you gave us your time and you gave us such an insightful information. I think it's going to help our viewers. हमारे viewers को बहुत एक informative information मिल गई in terms of cancer, early diagnosis, and आपने बहुत detail में समझाया हम सबको. So thank you so much for taking time off and talking to us, and we hope to see you in future again. We'll invite you with another topic, and I'm sure that it will help our viewers to understand better.
Anytime. Thank you very much for calling me.
देखते रहिए आपका फेवरेट शो दिल से फिट ओनली ऑन राष्ट्र टीवी.